I have never seen this information explained anywhere, which is why I felt that it was important to create a graphic to help parents understand why the American Academy of Pediatrics, or AAP, does not recommend individual talk therapy or counseling as a recommended treatment for ADHD in kids, and why no type of individual therapy has ever shown efficacy in addressing ADHD-related issues in kids. ADHD is a developmental delay in executive functioning. Kids with ADHD have difficulty with episodic memory, which is remembering the emotions associated with past experiences and applying those emotional memories to the present. As an example, your son or daughter might have had a great time at a summer camp they attended last summer, but when you ask them in January if they want to go back, they'll say, no, it was boring. They say that because they can't recall how they felt 6 months ago when they were enjoying the camp. Another example would be in individual therapy. They were taught a relaxation technique to use when they get mad. But when they get mad, they can't recall what they learned in therapy because they were in a different emotional state in therapy than when they are angry. So to suddenly remember something from when they were calm and apply it in a moment of anger is unrealistic. Future thinking skills, or nonverbal working memory, is how we visualize ourselves doing something in the future. For kids with ADHD, the development of their nonverbal working memory is delayed, meaning their time horizon, or how long they can think ahead into the future, is about 2 to 3 years behind their same age peers. On top of this, if they don't see a visual image of themselves doing something, it's going to be difficult for them to activate their future thinking skills. This is why things like hanging up lists don't work for most kids with ADHD. Let's use therapy as an example again. Let's say they were taught a relaxation technique in therapy and were told to use it the next time they get angry. Well, if they can't visualize themselves using that technique the next time they get angry, and if the time horizon from when they learned it to the time they get angry is too long, then it's going to be useless. So this is why no type of therapy has shown efficacy in treating ADHD in kids, and why it's not a recommended treatment from the American Academy of Pediatrics. The ADHD Dude methodology is aligned with the AAP treatment guidelines and provides parent training in executive functioning, behavior, and social skills through the ADHD Dude membership site.